Good morning. Today's presentation is about women health. This is a very important subject that affects every woman, so consider it as a review to what needs to be done for women over the age of 40. The health checklist for women over 40 to keep track of the tests and procedures that you need after the age of 40. We have first screening test, knowledge is power, so get informed. Here you will find women's health fact and information about their medical care. The topics that we're going to discuss is the health of the woman over the age 40, testosterone, estrogen level in women, progesterone, hysteroscopy, pelvic exam, and pap smear and wet mount vaginal test. Screening first will start with breast cancer screening, and the procedure of the mammogram is done yearly, start at the age of 40 or earlier, depending on risk factor, every 1 or 2 years, depending on risk factor. Doctors' breast exam start at age of 20 and repeated every 3 to 4 years for women between 20 and 40, and then to be done annually. The breast exam may detect breast cancer between the age of 20 to 40 for women that can be missed sometimes by mammogram. Cervical cancer screening. The procedure to screen for cervical cancer is pap smear. Pap smear should be starting at the age of 21, and it's meant to detect abnormalities in the cervical cells that, if left untreated, it could progress to cancer. At the age of 21, we can do pap smear and pelvic exam. The HPV DNA test. The HPV is a virus that causes slow progressive changes in the architecture of the cells of the pancreas, and started at the age of 30 and repeated with the pap every 3 years. Now we have pelvic exam, pap smear, and HPV DNA test. This is recommended by some, but it is not a regular practice. The HPV to be done every 5 years until the age of 65. Pelvic exam is also involved. Gynecological and reproductive health. Gynecology and reproductive health service may include diagnosis and treatment of various conditions, including normal pap smear, infection of high-risk HPV, abnormal vaginal bleeding, bacterial vaginosis, endometriosis, heavy menstrual cycle, infection, ovarian cyst, pelvic inflammatory disease, pelvic pain, premenstrual disorders. Heart disease, we start to be measuring using a blood test to measure for cholesterol, the bad one, the LDL, at the age of 40 and then every 5 years. The cholesterol has 3 main things: the low density, which is the bad one, the high density is the good one, and then triglyceride. This has to be repeated depending on the level of the initial test. Then we have blood pressure measurement, start at the age of 18 and at least every year after that. Blood sugar, the fasting blood sugar, 45 or younger if overweight, every 3 years. The overweight start with the BMI 25 kilo per square meter, and presence of other risk factor like family history of diabetes, hypertension. Bone health, bone mineral density, it's used as an indicator of bone strength, and it starts 65 or earlier, depending on risk factor, family history, previous fracture and fragility, medication use that affect that results in bone loss, or probably GI problem that affect calcium absorption. Sex health, if the patient is sexually active, she's at risk of, whether she's at high risk of STD, get test for chlamydia, gonorrhea, syphilis, and take HIV test at least once, more frequently if the patient is at risk. We have colorectal cancer screening. It comes in different ways, either occult, blood in stool, or colonoscopy. This ideally start at the age of 50 but sometimes lower than that at the age of 40, depending on risk of family history. Other important screening tests, skin exam. Most skin cancers are curable. Ask your doctor to check your skin anytime you find a mole or skin changes. Eye exam. Be sure to get your eye exam regularly, every 1 to 2 years until the age of 60, to check for common problems like presbyopia, glaucoma, macular degeneration. Go more often if you have a vision problem or risk factor for eye problem. Hepatitis C. The CDC recommends that anyone at the age of 18 and above should be tested for hepatitis C at least once in a lifetime. It also recommends that test for people who are pregnant. Other ways of dealing with the issue of above the age of 40 is rest and diet and exercise. Rest and relaxation, healthy eating for weight loss. The healthy diet should be balanced. Essential vitamins like vitamin D. Human body cannot make vitamin D, so the patient needs to have supplements in order to save the bone health. To keep fit after the age of 50, the patient regularly exercising, this is an advantage, and you probably already follow exercise tips. Maintain weight loss. This explained why modest portion, healthy food, regular weight may help maintaining the weight loss. As we reach this age, there is risk of insomnia, and here is how to beat it. You have to wake up in the same time every day, develop a rhythm pattern, especially if you had a poor sleep during the week. If you suffer insomnia, you should get up at the same time every day in order to train your body to wake in a consistent time. Eliminate any stimulant, alcohol, and caffeine. Effective caffeine lasts for several hours, perhaps 24 hours, so the chances of it affecting sleep are significant. Caffeine not only causes difficulty initiating sleep, but also causes frequent awakening during sleep. If you are on medication such as a stimulant, a decongestant, asthma inhaler, ask your doctor. They should be best to be taken to help minimize the effect on sleep. Limit the naps during the day. While napping seems to be a proper way to catch up on a missed sleep, it's not always like that. It's important to maintain a regular sleep pattern and train oneself to associate with cues like darkness consistent with bedtime. Napping can affect the quality of night sleep. Exercise regularly. This is very important. Then limit activities in bed. The bed is for sleeping and having sex. If you suffer from insomnia, do not balance the checkbook, study, or make phone calls, for example, or watch TV. Avoid watching TV. Do not eat or drink right before bedtime. This habit can result in gastroesophageal reflux, acidity, and heartburn, and will affect the patient's digestive system. Make sure that your sleep environment is comfortable. Temperature, lighting, noise can be controlled. Good sleeping mattress. Consider having pet sleep somewhere else if it tends to make noises at night. Get all your worrying over before you go to bed. Reduce the stress. There are a number of relaxation therapy that reduces the stress, and it's very important for the body. Consider participating in cognitive therapy. Cognitive therapy helps a lot of people with insomnia. Tips to reduce stress in women over the age of 50. Build a support system like being with the religious part of religious community. Keep positive attitude. Let go of negative. Be assertive instead of aggressive. Find a way to relax. Develop a new interest. Get enough rest and sleep. Eat healthily, well-balanced meal. We'll come to a subject that is very controversial. Estrogen normal level varies widely. Large differences are typical in a woman, different life, or between two women on the same day of their cycle. The actual measured level of estrogen does not predict emotional disturbances. Estrogen in the brain, that is not to say that estrogen isn't a major player in regulating the mood. Estrogen acts everywhere in the body, including part of the brain that control emotion. Some estrogen effects increase in serotonin and number of serotonin receptor in the brain, modifying the production and effect on endorphin, the feel-good chemical in the brain, protecting from nerve damage and stimulating nerve growth. That brings us to the conclusion of this presentation. I hope this was useful to you, and I'm hoping that each of you follow the screening method, as it is very helpful. Have a nice day.